Hi everyone, we are excited to have you here in today's fun-filled learning session at Uolo. Here is a quick look at how you can submit your work after the class. As a first step, go to live.uolo.com. You can use any browser to access this site. On this page, you will see a list of all our classes. Scroll down and you can see the Submit Your Work button. And then you will see a list of the classes that you've last attended, which could, for example, show the dance or craft or science experiment classes you've attended recently. Next, it will show you the list of children whose names are registered in this mobile number. Choose your name from this list to submit your work. For instance, if you are Satvik Kumar, choose that name. And then choose the class for which you would like to make your submission. For example, if you've attended the New Year's Masquerade Party session and you'd like to make the submission for this class, click on the Submit Your Work button below that. And then upload the photo you've taken. Choose the image from your phone and click Submit. You can scroll down and view all your past submissions and see how many of your friends or peers have liked your work. You can also see others' work and like their work to inspire your friends. If you want to showcase your work on social media, that too is very simple. Click on Share, copy the link and post it on Instagram or Facebook or any other platform of your choice. Just a tiny reminder, your submission looks a lot better if you could click a photo in the landscape mode rather than the portrait mode. Do not forget to tag us at YOLO_app. I'm eagerly looking forward to all your submissions right after this class.
Hi there, kids. How are you doing? Welcome back to today's last and final class of the COVID-19 or coronavirus awareness course that we have going on. In today's class, we're going to go ahead and talk about the second wave of coronavirus that we have going on in India right now. It's going to be very, very focused on all of the current events that we have taking place. It's going to be talking about, everything that we have been facing right after that lockdown that we all faced. I spoke till that point where we had the lockdown going on, but after that I didn't really talk about anything that happened in India, right? And that's been like around almost a year, because we went out of lockdown on 31st December 2020, and now we are out of lockdown, so we have to talk about all of that. And before we get started before we get started about talking all of that, we can go ahead and talk a little bit about the certificate program and a little bit about the feedback program that we have going on. The certificate program is a very, very simple program wherein you will get a certificate at the end of any course that you attend, if you attend all of the classes of the course and you make all of the submissions. Now, I have always made it a point in informing to you why it is so important for you to go ahead and get a certificate like this. It is very important because, if you go ahead and, attend all of the classes and get a certificate, then what will happen is you'll sort of have like an identification or a proof to provide to whoever that you go ahead and provide tomorrow, that these are the skills that I have learned, this is my skill set, and this is what I'm good at. And I want each and every one of you to have something like that. I want each and every one of you to be able to give that form of recognition through a certificate to whoever you go ahead and provide to tomorrow. So definitely have that motivation to go ahead and get that certificate. So just simple things, right? You're already attending the classes, make sure you attend all, don't miss out on any. And finally, go ahead and make your submissions. Not that hard, right, to go ahead and do. So just really, really simple, go ahead and do it. Apart from that, the feedback program, very, very important. Again, you will go ahead and get personalized feedback from my end. I personally will be giving two kinds of feedback. One is going to be feedback in which I go ahead and talk to you about all the good that you're doing, so that is all of the positives that you have in terms of your work. And the second is going to be a little bit of a critical feedback, which I feel like, for example, you can go ahead and do this a little better, or you can go ahead and do that a little better. That is going to be sort of like a way in which you can go ahead and improve on what you already have, because I'm going to find and identify some of those critical points that you can work on. So that is going to be the second bit of it. So now let's talk about what we're going to be doing today. Like I mentioned, we're going to be talking about everything that happened post May of 2020, right after we got out of lockdown. So that's what we're going to be discussing today. It's basically going to be a gist of how and what happened in India after 2020 of May, and then we will progress on to January of this year, and we will progress on to talking about everything that took place in the recent months of April and May. We are still in May right now, so April and May, we're going to go ahead and discuss about what the situation is like, what is actually going on. So we're going to go ahead and move on to all of that. So let's get started with all of the materials that you need for today's class. All right. The first thing that you need for today's class is going to be a sheet of paper. I need you to go ahead and take any size sheet of paper that you have, but make sure it's a sketchbook, drawing book, anything that you have. Any unruled sheet of paper would also do. If you do not have any of that, then you can go ahead and take an A4 size sheet of paper as well. It would work wonderfully well. The next thing that you need is going to be a set of sketch pens. The sketch pens are going to be required for you to go ahead and draw. If you remember, in the second class, we went ahead and did a black and white picture, and the rest of the classes we've been doing colorful pictures and colorful event formats of everything that has been going on. So today as well, we're going to go ahead and follow a colorful picture rather than a black and white picture. So, if any of you are new to today's class and you just wanted to go ahead and join in for today's class, or a little confused on what format I follow for my classes, then let me give you a little bit of information. We're going to be going ahead and discussing everything about COVID-19 and coronavirus, wherein I'm going to be talking, and your work is basically going to be to listen to everything that I am saying, as well as draw all of the illustrations that I have created on my sheet of paper. So, here you can go ahead and be a little creative. You want to change up the colors, you want to change up a little bit of the drawing, you want to add some things, you want to delete some things, completely up to you. You can go ahead and make all of those changes like you wish and you may. I'm just going to be going ahead and doing some bunch of simple illustrations, explaining and depicting everything that we're going to be talking about today. So let's get started. What I'm going to do first is I'm going to go ahead and take a pink color sketch pen, and I'm going to go ahead and draw sort of like a rectangle in which I'm writing SEP, which is basically stands for the month of September, and I'm going to make it sort of like a calendar design. So I'm just drawing a few loops on top, and then I'm going to go ahead and draw a house. Now this was the time when we had the unlock period going on, so I wanted to just go ahead and determine that very, very easily and simply. So hence I'm drawing a house, and then I'm going to go ahead and draw a bunch of arrows coming out of the house. Now, like I mentioned, the second wave of COVID-19 started much later on and started around only in this year. But before we get on to the events of what happened in this year, it's better for you to go ahead and have a easy and descriptive timeline of what actually happened right after that 21-day first set of lockdown, then the 14 days of lockdown, and then the other 14 days of lockdown. So like I mentioned earlier, we were in lockdown till around 30th of May 2020, after which we had something called the unlock period opening, coming up. Now, if you are like wondering what the unlock basically meant that people could move around, but there were a lot of restrictions on what people could do and what people couldn't do. Now, though it everything was open, they were opening up only things that were better to be opened up. For example, as far as I remember, restaurants, cinemas, things like that took a little bit of time to open up. Even when they did open up, for example, restaurants, they did not allow the 100% capacity. So what I mean by 100% capacity is, for example, there could be 20 people sitting in a restaurant, they have 20 seats, then they would allow only 10 people to be sitting in the restaurant. And the reason for that basically is to avoid overcrowding, to maintain as much social distancing as possible, to avoid as much like limitation of the spread of the virus as possible. So we were in unlock of 2020 in right after May. So that was June, July, August, September, October, November, December. And after that, we saw a little bit of a change happening. So we'll discuss that later. But basically, right after that, June, July, August, September ish around, we were all in that unlock period wherein slowly things were opening up for us to go ahead and do, because we were recovering from the pandemic. So let's actually draw that recovering bit out of the pandemic. So I'm going to be taking a red color marker right here and drawing that graph line again. And I'm drawing a bunch of lines, and I'm drawing a bunch of lines down as well. And then I'm drawing a curve U going up and then a down and bringing it down. And I'm writing the year 2020 right there, sort of like as a marker. Perfect. Now, what happened was, like I told you, we had that peak up and then we had that peak down and then we had that leveling out. Now, that leveling out that you see right here basically happened in the month of September onwards. September onwards, the number of cases dropped and was sort of flat lying. So, there were a number of people who were getting COVID, there were a number of people who were getting infected with coronavirus, but not as much as earlier. It was pretty limited. There weren't that many people getting infected. So what happened right after that was that it was a good phase for India to be in, because the medical load that was there. That's why I'm going ahead and drawing the medical symbol again here with purple. So go ahead and draw that with me. So the medical load that was there on the healthcare workers, practitioners, things like that, completely reduced. The number of people, who were going to hospitals and being infected and needed help were completely reducing. And hence, it was a wonderful recovery time for anybody who was practicing health at that point of time. Because it was really hard, everything they had gone through with the first wave. So many people were getting infected. So many people were, coming to hospitals, so many beds were being utilized, so many things were happening. And the healthcare system, like I told you in a bunch of classes earlier, was getting really infected, right? So what happened with the decrease in the number of cases was that the medical practitioners got a really wonderful recovery time and a break. Now this was also the time when again the research of the vaccination started. Currently, right now, we have a number of vaccines that exist all around the world, but in India, right now, we have the Covishield and the Covaxin, two vaccines that have come up in India. Covishield was not created in India, it was created in England, in Oxford, but Covaxin was created in India, but it is still limited in terms of its supply even today, but it was invented here. So, vaccines as well were something that were really researched upon by the medical health practitioners. Medical health practitioners also finally thought that, the amount of symptoms that we've collected, the amount of critical care that we have, if tomorrow any such form of issue does come up, then we can go ahead and handle it. They had handled it once and they thought they would be able to go ahead and do it once again. Now, apart from the medical health people, I want to go ahead and again talk a little bit about the opening up of society in general. Now, like I mentioned, people were going outside now, so the economy was doing much better, like the medical health professionals. So a lot of people actually started going to work, not IT related, but other people. For example, banks were fully staffed by now. Restaurants were getting fully staffed. Labor work was also starting out. So a lot of people who had lost their jobs in the first wave of the pandemic were finally getting back to, working, earning money, and the circulation of money all around in the economy had finally opened up. Even we as individuals could go to malls, we could go ahead and watch movies, we could go ahead and um, go out to have a fun time. We could go ahead and buy much more than essentials, rather than what we were doing in the first lockdown of just buying food and water to just live. Apart from that, we could go ahead and buy everything at this point of time, and hence the economy was getting kick started at this point of time. Now, one scare that did happen was in the month of November and December. So I'm going to be drawing a diya in symbolizing Diwali, and I'm going to also be drawing sort of like a cake. This is not going to be a birthday cake, but this is a cake symbolizing New Year's. Um, as and New Year's and Christmas, actually, both of those times. So we had Diwali in the end of November, and we had Christmas on 25th of December, and 31st of December 2020 was New Year. So this point of time was a little bit scary for the Indian government as well as people all around, because this was the time people would start meeting each other more often because of Diwali, because of Christmas, and because of New Year's. And by then, coronavirus was, the lockdown had long gone. People weren't really like scared of the virus anymore. So this was a time when people would go out, people would go to people's houses, people would celebrate, people would want to buy things. So because of all of that, maybe everybody was the government healthcare workers and the government itself was a little scared that the virus spread might increase at this point of time. And frankly, there was a little bit of increase in the spread of the virus, but not very, very extensively. It was a very minute spread of the virus that happened. Now, moving on from New Year's, we come to January. In January of 2021, so I'm going to go ahead and mark out with a rectangle the year 2021, the year that we are in today. So 2021. Okay, so in January of 2021, again drawing a calendar out for you to understand and mark that out a little bit better. Okay, in January 2021, like I said, the vaccine was, started being administered all around India. So that was again a very, very positive space for India to be in. Everybody, it was announced that the Covaxin and the Covishield both would be given to individuals in India, and everybody was very, very excited to go ahead and start receiving the vaccine that was created in India, as well as the Oxford vaccine of Covishield. Now, the process of giving the vaccination, I think I have told you earlier, but I'm going to repeat it once again, was that everybody from the healthcare system, that is, anybody who are doctors, nurses, pharmacists, people, staff working at the hospital, all of them were the first people to go ahead and start getting the vaccine, because they were the most important. They were in the front line of things, so they needed to go ahead and get the vaccine first. We call them COVID warriors. So those are the first people who started getting the vaccine. After them, everybody who was 45 and above with comorbidities. So comorbidities, I mean, if they had diabetes, they had BP, cholesterol, or heart condition, any form of illness alongside their age was a factor of giving them the vaccine. Apart from that, then it moved on to everybody who was 45 and above could get the vaccine, who was eligible for getting the vaccine. And then now in May of 2021, 1st of May 2021, the registrations for everybody who's 18 and above has started for the vaccination. So this was one of the most upbeat and positive things of the year that everybody did notice and was very, very happy about. Now, though it was something that was, really exciting and was a positive, we did have something that did come up in the month of April. So let us go ahead and mark that out. So from 2020, I'm taking my brown color sketch pen and drawing a big calendar, sorry, a big graph over here, demonstrating what is happening in 2021. So this is the first wave that I drew right here, and there I have my second wave of COVID-19 that is there. And this basically started happening in April. So I'm going to go ahead and draw again a calendar sheet with that as like a justification of April. Now, no, last year in 2020, it was predicted that there would be a second wave of COVID-19 in India around March, April, May, June of this year 2021. But as things were going okay and as things were going good, nobody really assumed that COVID 19 would come again and if there would be a large wave of COVID 19 right now. So that was something that people had not predicted. But as the start of May started, the number of cases started increasing. So, two places that we saw the number of cases increasing quite a bit was Delhi and Bombay. The number of cases that were increasing was substantial, and slowly the government, earlier the national government, which is our Prime Minister Narendra Singh Modi, was the one who was basically going ahead and sorry, Narendra Modi was going ahead and kind of giving us the idea of when a lockdown would be put and when a lockdown would not be put. But this time around, it was the state government's call on whether a lockdown should be put or not. So, in April, when the number of cases started rising in Delhi and Bombay, the governments over there started indicating that there could be a lockdown or closure of places. The unlock that had happened would now slowly start going into again a closure where people and places would start being shut down so that the spread of COVID or coronavirus would reduce. In Delhi, they went into complete lockdown, and as well as Bombay or Mumbai started off, Maharashtra, sorry, started off with weekend lockdowns where they had complete shutdowns over the weekends and they had night curfews. And after that, they went into complete lockdown as well. Now, coming to our South Indian states, we have Karnataka and we have Tamil Nadu. If you live here, then you will know the situation. I live in Bangalore, so I am currently in lockdown right now. Here we had in Karnataka, we had the night curfew that came in, then we had the weekend curfew, and then we had a lockdown of 14 days, which again got extended for another 14 days. So, approximately a month of lockdown we are in currently. Tamil Nadu as well went into lockdown on May 6th and is going to be in lockdown for 14 days. But with the number of cases that are there in both of these areas and in Mumbai and in Delhi, we do not know how far the lockdowns are going to extend. But it is good that we are going to go ahead and be in lockdowns. It's going to protect us. So let's go ahead and again, get back into the cycle of what happens when a lockdown is put. I'm going to be doing three arrows over here. One talking about the concept of precautions, masking, and everything like that. So I'm going to be drawing a mask and I'm writing 2x right here. Now, the reason why I am marking 2x is firstly the indicativeness that you have to be extra precautious of COVID-19 this time they are saying the strain of COVID-19 that is spreading is more harmful than the first state of COVID. So double masking has become a very, very important concept. I have told you this several times. Wear a surgical or an N95 mask, and above that wear a cloth mask. Highly, highly, highly necessary. Wear it properly, cover your nose and your mouth. Do not have it hanging or anything. So make sure of that. And apart from that, it just being the masking, I also want to say that you have to be extra precautious, because this time they are saying that even youngsters and children are getting very, very, very highly affected by the COVID-19. Last year most of us were pretty immune and were asymptomatic to the strain of COVID-19 that was spreading, and a lot of people weren't falling as sick as they are. Last year we also had a very, very good recovery rate, but this time the recovery rate in India is not as high. The number of people who are falling sick is much higher. So it is very, very confusing and it is very, very sad. So be as precautious as preventive. Build up your immunity, like I have told you earlier. Eat well, exercise well. If you fall sick, go ahead and get medical attention as soon as possible. Keep getting tested, it's very important. Wear a double mask and keep sanitizing. So all of those pointers I wanted to give out. Another thing was talking about precautions. Stay at home as much as possible. If you are in lockdown, then you definitely know that you should be going ahead and staying at home. Only go out for any essentials. For example, you have to go ahead and buy food, you have to go ahead and buy essentials to cook, clean. All of that is completely fine. Go out for that. But again, when you go out, be as cautious as possible about your surroundings and everything else. Stay home, even if and when you do go out, maintain the concept of social distancing as much as possible. So make sure of that. Don't go out for unnecessary reasons, and tell people not to go out for unnecessary reasons. And finally, the last one, with my third arrow, is avoid trying to figure out when you will get to go out and go to different places. This could be shopping malls, this could be the playground, this could be the park, this could be going to go to a restaurant, go to school, go to work. All of that now is limited again. We have gone into the first phase of lockdown again, like we did earlier. So make sure to go ahead and be at a space where you are cautious yourself. The more cautious our society is, the more cautious you are, and you make everybody else cautious, the more safer we are all going to be. So right now we are in that second wave of lockdown, and this is the current situation that we are in today. Obviously, okay, so I'm going to stop sharing this now. Obviously, it is a very, again, a very hard time on everybody. And like I discussed in the last few classes, there are going to be there's going to be an individual effect on things, there's going to be economic effect on things, there's going to be the healthcare system, which is already getting highly, highly, highly affected by the whole virus. Now, in order for everybody to be okay and to be taken care of, you can go ahead and do your bit by staying at home, by eating good, by exercising well, by going ahead and going out only for essentials, by helping anybody who needs the help that they need. So make sure you go ahead and do your bit for society and for the economy as a whole. There might be a lot of people who are affected by the virus. Now, thank you so much for going ahead and taking up this course, because it's a very informative course, and I felt like each and every one of you should have got enough and more information about this. Now, apart from that, let's go ahead and talk a little bit about the feedback program. The feedback program is a really simple program wherein you will get personalized feedback from me. It could be critical feedback or positive feedback. I spoke to you about both, so critical or positive, whichever you want to get selected as part of the top 10. So make sure you make a submission for that. Okay, that's point number one. Point number two is going to be, make sure you get that certificate as part of any course. It may be this course, it may be in any other course. I want to urge you to get certificates, because collect as many certificates as you can, and you can go ahead and showcase it to your friends, teachers, peers, whoever you want right after you get out of lockdown, if you are in lockdown. So make sure, right? So to get a certificate, really simple. A, attend all of your classes of any course. B, make all of your submissions. Really, really simple. So I'm going to go ahead and see you in the next course, whichever course you join me next on. And I will be very happy to see you there, because, I've been loving seeing all of your work. If you are confused still about how to go ahead and make your submissions and are wondering how to go ahead and do that, have a look now, and I will see you in the next one. Bye.
Hi everyone, we are excited to have you here in today's fun-filled learning session at Uolo. Here is a quick look at how you can submit your work after the class. As a first step, go to live.uolo.com. You can use any browser to access this site. On this page, you will see a list of all our classes. Scroll down and you can see the Submit Your Work button. And then you will see a list of the classes that you've last attended, which could, for example, show the dance or craft or science experiment classes you've attended recently. Next, it will show you the list of children whose names are registered in this mobile number. Choose your name from this list to submit your work. For instance, if you are Satvik Kumar, choose that name. And then choose the class for which you would like to make your submission. For example, if you've attended the New Year's Masquerade Party session and you'd like to make the submission for this class, click on the Submit Your Work button below that. And then upload the photo you've taken. Choose the image from your phone and click Submit. You can scroll down and view all your past submissions and see how many of your friends or peers have liked your work. You can also see others' work and like their work to inspire your friends. If you want to showcase your work on social media, that too is very simple. Click on Share, copy the link and post it on Instagram or Facebook or any other platform of your choice. Just a tiny reminder, your submission looks a lot better if you could click a photo in the landscape mode rather than the portrait mode. Do not forget to tag us at Uolo_app. I'm eagerly looking